Thank you.
Thank you, Ignacio. And thank you all for joining and being here. I know Amanda and I are very happy and excited to be here to talk about burnout. We really appreciate everyone joining, and we really appreciate the VA and Be Connected being willing to allow us to have this conversation. It's been a difficult past few years for all of us, and especially for those of us who are helpers. And so we're really privileged to be here today to talk about some ways we can help to support you. Specifically, we're going to be talking about burnout, compassion fatigue, and vicarious trauma. And we're going to be providing some resources for how we can help ourselves so that we can continue helping others. And next slide, please. And before we get into our discussion on burnout, I just want to highlight that, of course, Amanda and I have no conflicts of interest to report, and all of the information shared in our presentation today is that of information we've gathered and does not reflect official views of the VA or the federal government. So just reviewing that disclaimer. And now let's talk a little bit about burnout. So Dr. Figley is actually the grandfather of burnout research and discussions. And this is a quote that I love because I think it highlights the internal experience for those of us who help. And so I'd just like to take a moment to read it. We have not been directly exposed to the trauma scene, but we hear the story told with such intensity, or we hear similar stories so often, or we have the gift and the curse of extreme empathy, and we suffer. We feel the feelings of our clients. We experience their fears. We dream their dreams. Eventually, we lose a certain spark of optimism, humor, and hope. We tire. We aren't sick, but we aren't ourselves. When we came across this, we thought this highlighted the internal experience for all of those who help, but who at the same time can suffer in helping just in carrying that burden. And so today we hope that we can help each one of you carry that burden, that we can help you lighten that load moving forward. We're going to talk a lot about what burnout is, compassion fatigue, and vicarious trauma, but we also want to instill hope in how we can reduce and prevent this in the future. Next slide. These are our objectives and really what we hope you all take away from today. We hope you leave our presentation learning more about what burnout, compassion fatigue, and vicarious trauma is. We hope that we've been able to have a really fruitful discussion on what some of the challenges are that as trauma-informed providers we experience, and that you walk away with tools that you can actively implement to help combat both compassion fatigue and burnout. It was one of our goals that we provide tools that are meaningful and realistic for each one of you to actually implement. And I'm really excited for us to share those with you because we put a lot of thought into being helpful for everyone. Next slide. So this is a short video.
Quitting smoking is not easy. If you are serious about it, talk to your doctor.
So that's a short video. So we're not here to talk about quitting smoking, but we thought it highlighted what burnout can look like in the office and sometimes maybe what we all have thoughts of doing. And in talking about a heavy topic, we wanted to make sure we added some levity. And so you'll notice that we've tried to add lots of imagery and jokes because that's a part of coping as well as having that humor. So this is a bit of a self-assessment. And I just like each one of you to take a few seconds to think about whether or not you're answering any of these questions positively. So do you feel fatigued or suffer from physical complaints? Do you feel unappreciated? Do you dread going to work? Are you noticing that you're feeling forgetful or wanting to call out of work more often? Or do you experience consistent change or clarity in your work duties? Do you feel underpaid, overworked, and understaffed? If you've answered yes or maybe to any of these questions, that's a sign that you may be heading towards burnout. And we want to talk a little bit more about that on our next slide. So these are our poll questions. So on a scale of 1 to 10, I'd like each one of you to think about how burned out do you feel presently? 1 being not burned out at all, 10 being really burned out. So another self-assessment. And then notice if you are feeling burned out, do you feel as if you have the tools you need to be able to cope with it effectively? So just more food for thought. We're not necessarily going to ask everyone to share, but we want you to be thinking about what your answers are. As in the latter half of our presentation, we're going to talk about specific things you can do to reduce and prevent it. And certainly Amanda and I will leave time for questions at the end where we can talk more about some solutions that maybe we haven't included here as well. All right, next slide, please. So this is just one model of looking at burnout, compassion fatigue, and vicarious trauma, and really looking at what is the difference between them and really what are they? And in this model, it highlights that all 3 are very much connected, which is absolutely true. We recognize that sometimes these terms get thrown around and they can be used interchangeably, even though they are all distinct phenomenon that we're going to talk about today. And from this model, we can see that compassion fatigue can lead to burnout, which then can lead to vicarious trauma. Where we're hoping to be able to start the shift for everyone today is to that compassion satisfaction. This is where you're feeling fulfilled, you're feeling pleasure, and as if what you're doing has meaning. So if you find yourself in any of those areas on the right, we're hoping again to move to that compassion satisfaction with some of the tools we'll talk about today. And now we're going to get into each one a little bit more in depth. Thank you. So let's talk about burnout. So burnout was initially defined in 1972 by Freudenberger, and he identified it as a demon born of society. And he was essentially highlighting that burnout happens when society puts pressure on working and being productive, and we start to focus all of our energy there and not necessarily on our actual quality of life. That was an early definition, and more modern definitions highlight the exhaustion, cynicism, and the inefficacy that we feel when we are overworking and when we have chronic exposure to work stress. We recognize that burnout can happen in any occupation, but it is especially high in those who work in healthcare and those who are helpers. And it can actually be as high as 52%. We want to talk about how burnout is not related to the individual. We don't get burned out because there's something wrong with us or we're not doing something right. There are many factors that contribute to that, many of which we're going to talk about today and hopefully provide some solutions to. Burnout itself is different from stress. A cycle of stress can pass, it can be short term, and it can certainly be overwhelming, but there's an end point. With burnout, it's longer, it's more frequent, and we don't necessarily see a way out of it. We don't see that it's going to be ending. And then within burnout, as we conceptualize it today, we think of it as having 3 distinct components. The emotional exhaustion. This is where we're tired, we're fatigued, we don't necessarily want to go to work. When we're at work, we want to leave work. We don't know how we're going to get through the day. We just are tired from giving our all and not necessarily seeing an outcome. And because of that, that can lead to what we call depersonalization. This is a detachment from our work, from our coworkers. This is an increase in cynicism. This can be feeling hostile and mistrusting our work as well. Research suggests that depersonalization is a way for individuals to cope with the emotional exhaustion that they experience. And lastly, we have that lack of self-efficacy. This is where we go to work, we're putting in all our effort, but we're not seeing any changes. We're not feeling as if what we're doing matters. Maybe we're a spoke in the wheel, but nobody really notices that, or it doesn't have meaning. We feel as if we can't have any impact in the job that we're doing each day. And that can be especially tough. Next slide, please. These are common symptoms of burnout. I'm not going to talk about each one in depth, but I will go through them. So a piece of it certainly can be that declining empathy, second guessing our choices. Is this a good fit for me? Feeling as if we're not making a difference. Again, not deriving joy from the tasks that we used to enjoy, having a hard time getting up and going to work, feeling underappreciated, feeling disconnected from our job and the values, wanting to avoid work. We actually know that individuals who are experiencing burnout are 2.6 more times likely to look for other jobs. They're 63% more likely to call off sick, and they are 23% more likely to wind up in an ER. So burnout has some significant consequences on our physical health as well. And certainly recognizing that COVID has had significant increases in burnout across all occupations and high levels of stress, anxiety, and insomnia as well. And all of those kind of fit within that physical illness. I do want to spend some time talking about chandeliering. This is a term we may not be familiar with. It's a term developed by Brene Brown that really highlights how we can get pushed over the edge with one more thing. And so what chandeliering actually is experiencing intense and overwhelming stress and pain related to a situation that is out of proportion to that situation and that time and place in the present, but is not out of proportion to your internal suffering. So if we think of that old phrase, making a mountain out of a molehill, this is when we've had too many molehills happen, that one more thing happened, and that pushes us over the edge. What that can look like at work is that new change in policy, which maybe it's a small change, one thing we have to do different, but it's the 20th thing we've been told to do different in the last month, and that pushes us over the edge, along with all of the other experiences that we've had from burned out and feeling undervalued in avoiding work and having all of those physical symptoms. This list certainly is not exhaustive. These are common symptoms individuals can have, but it can also show up in different ways for individuals as well. So just recognizing that. Next slide, please. And this is another way of looking at burnout and in the different phases it may have. And it really starts with us recognizing maybe we're not quite feeling fulfilled with work. So what do? We're helpers, we're high achievers. So we try to work harder. So we have a compulsion to prove that we can do it and that we can do it effectively. So then we're working harder, we're trying harder, even though we're not feeling great. So then we start to neglect our own needs, our own mental health, our own physical health. So then we start to try and avoid conflicts and not deal with everything that's going on both at work, at home. Maybe we start to revise our values and taking care of ourselves is not important anymore. And maybe we're getting some feedback from family members that they've noticed a behavioral change, but we're not quite receptive. We're denying that. And then maybe we start to separate from our life outside of work. We have more of those behavioral changes. We start to feel detached from work. We may have this sense of emptiness, which of course can lead to depression and anxiety. And then that can continue the burnout cycle. And that's something that I think is really powerful about this image, which is burnout doesn't stop unless we intervene. The cycle just continues and grows and increases in intensity. But we can intervene at any one of those phases that are identified here. Next slide, please. Now we're going to shift a little bit to compassion fatigue. I think compassion fatigue may be something that we're easier able to recognize, even though it is different from burnout as well. And so this is a state of exhaustion and dysfunction, biologically, physiologically, emotionally, as a result of prolonged and continued exposure to compassion stress. Essentially what this is we can work very hard to be compassionate to others. And if we're not feeling the support at work from coworkers, from leadership, that we can find it hard to continue to be compassionate moving forward. You can look at it as an empathic strain. That is, we've been so compassionate that at some point that well starts to dry up a little bit, and we find ourselves having a harder time being compassionate to our patients. Maybe we start to reduce or to minimize their distress, or we don't quite get it the same way we maybe did previously. And this is a cost of being overly empathic and not having the support that we need. We can also start to, again, not to minimize their distress and to feel detached from them as well, and to feel as if we can't quite help them as much as maybe we were helping them before as well. And so, of course, it includes changes in our ability to empathize, which can certainly be problematic when we're helpers. And it can also mean we're checking out emotionally, not just at work, but at home as well. I imagine we have all had those days where we had a really tough day at work, and then we come home and something's happening at home and we just don't feel like we have the energy to manage it right there and then. That's a sign that we need to take better care of ourselves both at work and outside of work as well. And it can also cause us to feel helpless and to feel powerless, to feel like we don't have power. We get into these fields because we want to help. And then when we have a hard time helping and a hard time caring, that can be especially problematic and distressing for each one of us. Next slides, please. We can also experience vicarious trauma or secondary trauma. And so this can occur when, again, we've had repeated exposure to individuals' trauma details, their stories consistently, and we have a hard time being able to separate ourselves from the information that we've been told. So what happens is we start to experience an inner change within ourselves. So maybe we start to take on some of those symptoms of post-traumatic stress, even though we haven't maybe experienced an event or the events that are being shared with us in our appointments with our patients, but we're having a hard time leaving work at work. And that can look like having nightmares. It can look like ruminating over the details and even experiencing a fundamental shift in our beliefs and values. Maybe before we thought the world was generally safe, that people were generally good or helpful, but now we find ourselves thinking the world is dangerous. People are bad. I have to be in control all of the time. And we start to really experience those secondary symptoms of stress. Other symptoms can be an over-identification with the individuals we're working with. We can over-disclose. What that can look like is maybe in session, it's less about the patient and it becomes more about them. This is something that Amanda and I have both experienced working with individuals where they've come into our office and they've talked about why they were seeking services with us and have shared how maybe they had previous providers who they didn't feel like were listening to them because the provider was talking about their life experiences and over connecting with them and not leaving room for the individual to be the focus of the session. Can also result in a loss of boundaries, maybe suggesting, I'm available 24/7, not having those limits when you're outside of work. Preoccupation with the patient and trying to save them or to rescue them, going out of your way to help them and taking some of the accountability and responsibility off of them for their own recovery journey. Certainly there can be countertransference. We could withdraw or avoid. Maybe we find ourselves always calling out sick the day we see that one patient, finding reasons not to see them, pushing their appointments farther out, anything we can do to try and avoid them. Now, vicarious trauma is different from compassion fatigue. In compassion fatigue that I just talked about, we're having a hard time being supportive to our individuals. But with vicarious trauma, we can actually be experiencing that secondary stress, which of course is going to be problematic in allowing us to be helpful for individuals and allowing us to maintain that quality of life and our own self-care as well. Next slide, please. I want to spend some time talking about some of the vulnerabilities that are especially unique to trauma providers, because in our roles, we come across some unique things that others may not. Some of those, of course, are related to the client characteristics, which is we can be seeing a large number of clients per week. So we may have increased exposure to trauma details or increased exposure to individuals at varying levels of recovery when we're trying to help. We can also work with individuals who maybe are having a difficult time making progress because of their symptoms and their life experiences. Maybe they're not making progress as quickly as we would like, and we start to internalize that and we take that on as us not being effective. We can also work with individuals who may have ineffective ways of coping and interacting with others. Maybe they have a hard time respecting the boundaries we set in session. Maybe they have a lot of avoidance, which of course is consistent with trauma, and they're canceling appointments all the time. They're not doing homework assignments, or they're not coming to session and being open or being honest with us. That can be incredibly difficult. We can also work with individuals who have high level needs and who may experience crisis more often, which requires us to demonstrate large amounts of empathy, even though we may be frustrated, and to continue to maintain those firm boundaries for their well-being. All of those things can be difficult and are unique to working with those who've experienced trauma. And then we also have our immediate environment and how that can provide some stress and lead to burnout and compassion fatigue. And that could be having supervisory or leadership concerns. It can be a lack of safety, both physical. Do we feel safe in the area of town in which we work, in the building in which we work? Do we have security or police presence available when needed? Do we feel like we have the emotional and psychological support that if we have concerns, we can talk about it with a trusted coworker or supervisor? Do we feel like if we need a break, we're able to communicate that effectively? Or if we need to consult, is there a coworker nearby who we can just debrief with and receive advice on? And of course, in this virtual age of care, there are issues with technology and equipment, which can create a lot of frustrations. Not every individual is savvy with technology, and even with all of the support that we have, internet and connection can still go down, and that can be frustrating in working with these individuals as well, even though those are things that are out of our control. Next slide, please. There are also systemic characteristics, and Amanda is going to talk a lot more about these in just a few minutes, but rapid changing policies and procedures, trying to fall in line with all of our expectations, even though the expectation is changing, while still providing a high level of care. Being understaffed and feeling as if our work isn't valued and we're being underpaid and we're required to take on more clients moving forward. All of that can be difficult. High staff turnover can certainly impact morale as well, because then that means we don't have enough individuals to consult with, or maybe we don't have the support in office that we would like. And it can just be sad to see people we care about leaving the organization that we care about. We can also have a lack of sufficient resources, whether that's actual office supplies or something we joke about is working bathrooms as well. We can have a wide variety of needs that maybe we're not fully able to meet while still expected to do our job. Of course, the lack of recognition of appreciation and awards and, that metaphorical pat on the back that we all need as human beings. And one I think that as providers comes up quite a bit is that delicate dance and balance of recovery goals and patient needs. We are in this field because we care and we want to help in whatever way possible. And sometimes the ways we want to help may not actually help in moving individuals forward in their recovery process. And so that can show up with requests for letters for service connection, disability, or service animals. And speaking from the VA, we have specific guidelines and policies that we are expected to follow directly related to both of those things, directly related to service connection, in which we have memos and mandates that prohibit us from writing letters of support. And that can breach rapport, and it can be really frustrating in wanting to help someone, but being unable to do so. And also thinking about what message these things send when we're saying recovery from trauma is possible. Research says that is absolutely possible. Our clinical experience tells us it's possible, but there are lots of things that can slow that progress down. And being able to navigate those patient requests in a way that is helpful for them, and also in a way that helps promote their recovery and not over accommodating or reinforcing any avoidance as well. Another thing that comes up often for us is that request for service animals. We get that quite a bit. And again, the VA has specific guidelines that we are required to follow for that. And we actually had an ethics CE several months ago that was conducted by a PhD and JD, and their recommendation was very firmly not to write letters for service animals. They told us that that was within the forensic realm and that we would be acting out of scope, and that our licensing boards would likely view that as acting out of scope. And again, that balance of providing competent service, practicing within scope, within our ethics, and meeting our individual patients' needs can be a delicate balance that can lead us to burnout as well. Sometimes we may want to help, but we can't actually help within the confines of our position. And that can be very frustrating for us as well, and certainly frustrating for them. And then we have to navigate that in the room as well. So lots of different needs that present and different vulnerabilities that come up as a trauma provider that we have to navigate moving forward, that can lead us to burnout and compassion fatigue, and of course that vicarious trauma as well. So all good things that are food for thought. And I'm going to transition it over to Amanda, who's going to talk a little bit more about some of these characteristics, and who is going to get to really the meat and the potatoes, which is how can we help you with these things if they're present?
All right, thank you so much, Courtney. So as she's briefly addressed, we're going to talk a bit about the systemic impact real quick. The bulk of the rest of the presentation is focusing on what we can do within our control, how to empower ourselves to address these things, but we would be remiss if we did not discuss this impact as well. So the World Health Organization classified burnout as a syndrome that results from chronic workplace stress that has not been successfully managed. So if you can kind of sense the tone from that definition, it's not necessarily well received by many. So Christina Maslach, who's helped a lot with burnout, she basically shared concerns with this, and her response was pretty poignant. She said categorizing burnout as a disease was an attempt by the World Health Organization to provide definitions for what is wrong with people instead of what is wrong with companies. So it becomes a person's problem, not the responsibility of the organization that employs them. So that focus of, what's wrong with them and that staff member, we need to get rid of them instead of addressing organizational issues that are likely impacting staff. The next quote dovetails off of that perfectly. So we often think of burnout as an individual problem. It's solvable with simple fix techniques like learning to say no, more yoga, better breathing, practicing resilience. But there is a great deal of evidence mounting that personal Band-Aid solutions are not enough to combat this. The responsibility for managing it has shifted away from employees and towards employers because burnout is preventable. And then it goes on to provide some recommendations for what this may look like to address it, including wellness offerings that the agency actually provides as a part of their strategy for staff. I know Courtney kind of joked about this already, but we do laugh at work about how many times we're told to just do yoga. And I do yoga, not to dismiss the brilliance of yoga, but sometimes it just misses the crux of the issue to continually be told how to manage things when some of the things causing us distress are maybe not within our control. A Gallup poll of 7,500 employees selected reasons that they are experiencing burnout, and you may notice a theme with these: unfair treatment, unmanageable workload, or confusion on the clarity of their role, poor communication or support from managers or leadership, and unreasonable time pressure. Now, whereas we may be able to impact some facets of these components, largely these are outside of our control as staff. And so another quote actually mentioned, psychological stress occurs when our resources such as social support and our autonomy actually become insufficient to meet the demands of our job, the workload, or even the time pressure we may get to get tasks completed. So of course, that's going to lead to resource depletion for us. And burnout can occur when we don't have the opportunity to replenish those. Next slide, please. Okay, so some examples of how this can be addressed on a systemic organizational level. A lot of research articles and studies made these recommendations, and Courtney's mentioned a few, but of course, first and foremost, a manageable caseload. It needs to be something attainable for one person to do. Supportive supervision, more of that collaborative approach. Professional development and trainings. This is something that we saw repeatedly when we were preparing for this presentation. It's the agency putting time and resources into their staff, constantly trying to grow, constantly trying to progress, right? Making sure we're not staying stagnant, building on trainings and skills. And then increased or maintained control within our duties, as well as increased or maintained supervisor support. And that's within the chain of command, all the way up to executive leadership, if that's how your agency is structured. Coworker and social support, I'll talk more about this as well, but this was repeatedly mentioned in terms of burnout mitigation, just the importance of collaboration and connection to make sure we don't feel alone, to get that support and that validation was paramount with managing burnout. Staff appreciation, like Courtney mentioned, for obvious reasons. It's nice to be acknowledged, to have that encouragement. And then feedback seeking from leadership to break down that power differential. It's a natural part of work settings. So to have leadership that is trying to figure out with staff what's working, what's not working, what needs are you not having filled, what resources are missing. Even if it's not necessarily feasible to address all of them as much as we would like, that was actually shown to decrease stress in the workplace, just to even have that conversation and to be a part of it. Communication skills training may seem kind of strange, but if you think about it, the more distressed we're getting, if we're experiencing signs of burnout, or in our environment, if we're under-resourced and things like that, communication is going to take a hit. Less tolerant, maybe we're sharing things less effectively. And so a lot of agencies, when they implemented this, they found that burnout improved because it was a healthier workplace environment. And then finally, meditation and mindfulness options, but specifically available through the agency. So having an agency perspective that this is valued, that self-care is valued beyond words, that we're actually providing the opportunity, which of course comes with the expectation that there would be protected time for staff to participate in these. Next slide, please. So this quote was sent around to some of our peers, and we kind of all jokingly felt called out by it a little bit, because I do think it has some important truths. The things you complain about are most often teaching you where you need healthier boundaries. Now, we did not include this in the spirit of, dismissing issues. I'm not a big fan of the judgmental word of complaining, but we did include this with the purpose of acknowledging the empowerment that we have, the options that we may have. Even if we don't have as much control as we would like, there are things that we can do. And the goal of this in the next slides that we'll be going over is to be mindful of our warning signs. I mean, as much as these unpleasant emotions can be tough to tolerate, they are trying to teach us information. They are trying to give us feedback about how we're interacting with our environment, how this experience is going for me, whether on a systemic level or within my sessions with a certain population. It's trying to tell us what's going on and trying to prompt us and motivate that change. So being mindful of that and using that to make our choices. And if you're familiar with the concept of distress tolerance, it's intentionally choosing your goal for that situation. Am I trying to figure out how to engage more effectively with peers, with clients? Am I trying to figure out how to remain in this job so that I can get to a bigger goal after? Or maybe is it to even pursue another employment opportunity if I feel like I've exhausted all of my options? So intentionally making choices to line us up with that for our own well-being. Next slide, please. So vicarious resilience is an example of something that, that we can manage individually in our sessions, but also can be supported with the structure of our agency as well. It's essentially when providers begin to experience positive growth in their own lives after repeatedly witnessing that growth and resilience with their clients. So appreciating and implementing what we learn from their healing process, watching how they navigate that, the resilience that it takes to go through it, to continue to face trauma treatment day after day. It's not an easy task. It takes a lot of strength, even if our clients don't always see it that way. And using that knowledge to navigate our own personal struggles, that motivation, those lessons, it can transform a therapist's inner experience. And it results from continually empathetically engaging with our clients in trauma work. The other beautiful thing with vicarious resilience is it can increase confidence. So Courtney mentioned the self-efficacy piece, and this is something that vicarious resilience can assist with. So basically, we begin to believe, in our abilities to provide services that assist them, that help clients to meet their needs, support and validate them, and promote their own healing and recovery. I mean, it takes a lot of trust and a lot of, safety for a client to feel comfortable to engage in trauma work, especially if you haven't quite had a chance to build up that rapport yet. And I tell my clients all the time, I'm in a privileged position and that I get to see this work every day. So they may not know that yet. They may not have had that opportunity. But I know that what we do as providers is infinitely important. It's incredibly valuable. It works. I can tell them genuinely to my core, I believe in these therapies. I know they're going to be effective, and that if they show up and I show up, chances are pretty high we're going to be able to meet their goals. And that's something that confidence from witnessing that in session, I've been able to relay that, and it helps with retention and services as well. So how to actually build vicarious resilience, and practical steps. The first one is using empirically supported treatments. So these modalities are evidence-based. There's decades of research behind it. We know that it works, especially when we stay true, the fidelity to the program. And so the more that we provide care within those structures, the more likely we are to see progress and improvement to help clients reach their goals. This also includes measurement-based care, being able to see changes in their symptoms and their distress, being able to see changes in their relationships. All of those things help with building up confidence and resilience, because we know we're providing something solid and beneficial. And then positive acceptance. This word can be tough for a variety of triggers that we may be experiencing at work, in our environment, at home. But that acceptance piece is accepting those changes in our attitude from these relational experiences. So actually allowing ourselves to be changed for the better from what we're witnessing. Next slide, please. So shifting gears a little bit to what we can do individually. So 7 Habits of Highly Effective People, for those who aren't familiar, it's a book by Stephen Covey. Essentially, it looks at a lot of different ways about how to be most effective. He teaches 3 stages of maturity. So there's dependence, independence, and interdependence. And like I mentioned a minute ago, that connection, that collaboration is huge for burnout mitigation. And Covey basically shared the same concept. Interdependence is the goal. It's an attitude of we can cooperate, we can be a team, we can combine our talents. It's also the focus of having a win-win. So between providers as well as leadership, trying to, approach each other with value and respect towards the other party, or whether that be us with our clients, so that it's a win-win situation as much as we can. And then the way that they break this down is sharpening the saw. So balancing and renewing our resources, energy, and health for long-term sustainability. And there's the graphic that's on this slide, as well as the book, uses some different terms, but it's the same similar concepts. That with the 4 quadrants of this graph, it's basically sharing that we want to build and foster these areas, each of them separately, moving forward as much as we're able. The idea is that if we're not building or putting time into one of these sections, it's like a leg of the chair being gone, and it's no longer going to be stable or as balanced. We can start to feel a little bit more uneasy. And so that's the idea with this, is trying to foster each of these areas, build these up with different skills, so that these quadrants can help keep us more stable as we go through any of these difficult stressors. And you'll see with the idea of the upward spiral, it's something that we constantly want to achieve. There's not necessarily a finish line. The goal is that we're constantly growing and working on these areas, because our needs are going to change. Our distress levels are going to change as we go through life and different issues. So just doing our best, continually being mindful, which this may seem like review. We tell our clients about these things a lot, most likely, but we're human too. And if heaven forbid, we have something going on outside of work as well, it can be tough to be mindful of these things. We can be in the thick of it. And so this reminder can be helpful. So physical or body, going to doctor's appointments, exercise, sleep, diet, things like that. And then intellectual or mental side of things. So reading a book, learning new things, building mastery over new tasks and hobbies, building up your confidence and efficacy in other areas. traveling, belonging in various settings from, community levels, church, community groups, things like that. And then spiritual or soul. So journaling, Bible, prayer, service to others, all of these things can help us feel more balanced regardless of what we're going through. There's CBT-based material for a manual called Overcoming Stigma, if anyone's heard of it, and they use an illustration that's always just really stayed with me. So the idea is that if you think about a circle and have your name in the middle of it, and then you draw a circle for every single role, identity, interest that you hold. So, a mom, a wife, a sister, a best friend, an employee, all the way to your hobbies. I hike or I go to church or all these things. When you have something that impacts you in the work setting, it's a little bit more effective to navigate it when we have all these other areas of meaning that kind of bolster us. We have identity in other places. And when we start to struggle, it's natural for those things to kind of go away over time or to lessen. And so when we struggle with something like work, it can be a little bit, quicker for it to kind of knock us down because we don't have these other things supporting us. And so the importance of finding belonging and identity in other areas outside of work is really beneficial. And you can see with that last little blurb on bottom, self-care should be a quality of life activity. So basically, there's a lot of things that can be good for us. If someone wants to quit smoking, that can be good for you, but I doubt it's going to be what gets you up in the morning. As you can see from the video we showed at the beginning of the presentation today, that can be pretty triggering. So just being mindful of it being a quality of life activity that actually enhances your happiness, your joy. Next slide, please. Okay, so doing what matters. There is a huge push with managing burnout to be mindful of your values. So values are internal and subjective. They're going to vary from person to person, and they do govern our behavior. And research shows that we are the happiest when we do things that align us with our values, things that we are invested in. And so that's what we want to consider when we're trying to add these quality of life activities back in, is asking ourselves, what actually does bring me joy and what's making my life meaningful? That could mean bringing more attention to family and to work or things like that. And then acceptance of our own limits, as well as the limits of our control within our environment. And as I tell clients, I view acceptance similar to forgiveness. Choosing to do it once doesn't mean it's never going to have to be chosen again. It's an intentional action. And we may need to be mindful of that. And so the goal with this is kind of living in that gray area, which can be kind of tough, but it's all about balance. So giving and getting, we have to replenish ourselves for this to be maintainable. In a systemic type setting, this includes the other party being willing to contribute in a similar fashion, right? That's the part that may be outside of our control. But just being mindful, am I also receiving so that I can replenish? Boundary setting. This can be in various situations, right? With our clients, with our peers, as well as our leadership. And they may not always be easy to set, but the hard thing is if we struggle with setting these, we can feel taken advantage of, we can start to feel resentful, and then we can even dismiss or invalidate our own needs when we're struggling with that, which can increase our distress. So at the end of the day, trying to be mindful of what do I have control over? I may not get to choose how someone tries to treat me or what I experience, but I do get a choice in how I respond. I get a choice in what I internalize, and also what I tolerate. The next one, involvement and detachment, is essentially an emotional boundary. We can be involved in problem solving. We can provide empathy to our clients and listening, but being mindful of whether or not we're taking ownership where it's not ours. Essentially, at the end of the day, it's that realization that I can't control the choices and actions of others. I can provide support. I can provide the skills and the resources. And at the end of the day, I want to make sure I'm promoting their self-determination, meeting them where they're at with their needs, And that may be tough if we see, someone's potential or what would help them. It's tough to manage and tolerate that without trying to take it over or change it. But that's essentially that emotional boundary that we need to protect ourselves as well. Patient needs and therapist needs. So taking reasonable time off for doctor's appointments, taking care of ourselves with vacation time and mental health day. Even if you don't have a reason, we're still allowed to do that. Again, we want to be mindful. I'm not encouraging client abandonment or anything like that. But just being able to take time for yourself, which can be tough if you're in a role where maybe you're one of two people that's doing work for a whole population of clients. It can be tough to set those limits, but it's still equally important. Like we've probably all heard, we can't give from an empty cup. The other beautiful thing about this is we are trying to teach our clients how to be able to have that quality of life and function outside of a professional setting as much as possible. So that's modeling, right? Teaching those distress tolerance skills, teaching the ability to manage apart from professional assistance. We want them to be able to do that. And so that's actually an opportunity to model that as well. Time with people and time alone, understandable, making sure that we're spending time looking inward at any needs we may have, which I'll go into on the next slide. And then as Courtney's already addressed, power and powerlessness. Like I've mentioned, there's understandable power differentials in all the aspects of our jobs. And so trying to redirect to the parts we can control and acknowledge the parts we can't, or that maybe our agency has to own. And then finally, being mindful of environmental vulnerabilities and our basic needs. And again, this may seem like a simple one, but when we're in the thick of our own stressors, this can be some of the stuff that we forget to look at. I know personally, if I'm not sleeping well, I have to be more mindful of using my skills or how I respond, how I engage with myself or with others and clients. And so just be mindful. Is there anything within your environment that maybe is taking away from your emotional energy? The way that I explain it to clients is, I mean, if you consider having every day $1 worth of energy, if I'm not sleeping well before I even put my feet on the ground, I may be at a 40-cent deficit. And so that only gives me 60 cents for my day before I even navigate anything. And that could be anything from running late to work to getting cut off at work or on the drive in to client or organizational issues. And so it can just all of a sudden really quickly get to the point where you're kind of at your peak for coping. So just being mindful of that. I read that Steve Jobs actually wore the same thing every day to reduce his decision fatigue. I'm not saying we all need to go down the rabbit hole to that degree, but it's a similar concept of reserving your energy where you can. Next slide, please. So with that being said, this slide can maybe bring up some tough questions, tough concepts. It's that importance of self-awareness. Just like with any profession, there's a reason we go into that field. So being mindful, holding curiosity, and notice the word curiosity instead of judgment, but being mindful about what is my motive for helping? Am I viewing it as helping versus saving? So is it coming from a healthy, balanced mindset? Is it altruistic, or am I maybe giving with strings or expectations attached? Sometimes because of what we've gone through ourselves, we may be giving to fill a deeper need. Maybe like Courtney mentioned, it could be countertransference, or we're starting to over-identify for any given reason. Sometimes that belief of I have to help or no one else will do it, or maybe that fear that they won't be able to do for themselves, so I have to. Just being mindful of that. And then another tough possibility, are we using this act of service of helping to actually distract from our own struggles? We're all bringing our own stuff to the table, and as prevalent as trauma is, I mean, between direct or indirect experiences, it's not out of the realm of possibilities that we may hear or experience something that resonates with us. And so are we able to effectively set those emotional boundaries? Are you able to notice with your warning signs or your self-awareness that something's coming up? And are we seeking supervision? Are we doing the appropriate self-care or personal treatment as needed? And this is just a brief aside, and Courtney mentioned it as well. Sometimes, along my career, I haven't always felt I've had a judgment-free workspace to discuss these things, right? Some people feel ashamed if they're having a response to a client. or, having trouble setting those boundaries, when in actuality, it's a very natural part of human existence. Like I said, we are human as well. We're bringing our own stuff into those sessions, and just having a safe space without shame or judgment to discuss those things is important. Whether that be, sometimes just discussing it, identifying that trigger can be sufficient to set those boundaries. Other times we may need to change a client to a caseload, someone else's caseload, for example. Are we helping from compassion and generosity? Are we helping because we think people cannot do it for themselves? So helping for or helping with? How do you see clients? Are we labeling them? Because that's absolutely going to impact how we approach them in our treatments. And then your own self-care beliefs. We may have gotten negative messages about taking care of ourselves. It may feel unjustified or undeserving. We may find the need to minimize our own struggles. I can give for everyone else, but I can't justify it for me. The other thing is, even some beliefs I hear a lot as well is kind of, that sense of self-worth can be externally located. So if I'm not helping, if I'm not achieving, then I am unworthy, or I am a failure, things like that. It may be tough to consider what our identity is apart from helping others. Or the belief of some people have it worse, right? I should be able to handle this. I'm hearing these cases every day, and other people have had it worse. And that may be kind of a sneaky attempt at trying to be positive, but it's also can be shaming or self-invalidating. It can even make us feel weak. So being mindful of what beliefs we have around self-care. Next slide, please. So some strategies for burnout mitigation. Some of these we've already covered a little bit, but knowing your warning signs and self-awareness is huge. That could be engaging in your own therapy. If there's something you're struggling with making sense of or identifying, I strongly encourage it. A lot of us use those resources. Seeking medication assistance, if that would be helpful. Coping throughout the day versus waiting to cope until you hit a crisis. So essentially the idea is that, I saw a definition of a crisis as being when the skills that you have are no longer sufficient to address a level of distress you're experiencing. That's when any one of us can hit a crisis. So the goal is to have a plan to cope ahead, to cope as soon as we see these things popping up, and to even cope throughout the day. So some examples that I've used, because I get distracted at work, I'm busy at work, I put reminders in Outlook or even on my phone to get up and stretch, go for a walk. This could be as simple as going to the bathroom on the other side of the floor, just a little bit further away, changing your setting, essential oil diffuser. I have a second screen in my office since I don't have a window and it can feel a little bit like a cave. I use that second screen for, the free hours of YouTube videos of the ocean or forest scenes, things like that. And hearing that in the background helps remind me to take a breath. I've had friends who have yoga mats in their offices and they stretch as much as they're able during the day. Regular consultation, supervision, or staffing, like Courtney mentioned, this personally for me is a huge one. Being able to discuss, if I hear something really tough in a session that's for whatever reason harder for me to kind of get through, talking about it more times than not seems to be sufficient to help, to be able to leave that at work before I go home. So I'd strongly encourage that connection. And like it mentions, increase connection at work as well as outside of work with social activities. This next one may not totally be within our control, but if you can, diversifying your caseload, maybe instead of working with strictly trauma, maybe there's other populations or mental health conditions that you'd be able to take some clients from, or even adding administrative outreach, education, trainings, things like that to diversify. I know for me personally, as much as I love working with trauma work, I do not think it is meant for me to do 100% clinical, whereas some of my peers, they love it and they have no concerns with it. So maybe that's something to consider. Small rewards at work, outside of work. I know some peers and I do Starbucks run. If we have a cancellation, just take 10 minutes to go do something like that. Stress management techniques for different levels of distress, deep breathing and mindfulness, grounding, counting, using the logical side of our brain, right? Counting down from 100 by 7, using mantras or quotes, professional boundaries, changing your environment, getting outside of your office, going for a walk, things like that. faith-based strategies, prayer, Bible or other religious texts or religious gatherings. An accountability partner, which is a step deeper than talking to a peer. This is somebody where there's a bit more safety, vulnerability to ask some of those hard questions that maybe they can challenge and help explore what's coming up for you in a loving way as well. Provide that insight. And like I mentioned, even becoming involved in our own therapy, if that's what would be beneficial. Next slide, please. So this is just to kind of get the wheels turning, especially, implementing new habits are hard, especially if we haven't really been able to engage in much self-care just yet. So the idea is to plan ahead. I want to have those coping skills in place and available to me when I need them, as opposed to waiting to kind of put this plan together in the moment. And we want to have a variety of skills. If I'm in an office during a meeting, I can't go garden, right? If that's my usual go-to, I want to have something I can use in that meeting to de-escalate, and being mindful of that quality of life. The other thing with implementing this is giving yourself some compassion. Maybe we can look back and say, 5 years ago, I used to be able to do this coping skill 5 days a week, and now I'm not doing it at all. Be kind to yourself. Maybe you just start out with the expectation of 1 or 2 times a week for 5-10 minutes, if that's where you want to start, and build yourself up, building up that mastery, that self-efficacy that you can achieve this. Another rule of thumb is to maybe even combine it with a habit you're already doing. So it's tough to start new things. So if you're already doing something every day, for example, like having a cup of coffee in the morning, pair that with sitting outside and watching the sunrise, or listening to music or reading during that time, and adding more quality into those moments with the habit you're already engaging in. So just being mindful, what can that look like tomorrow, this week, or next month, and making it realistic for ourselves. And next slide, please. And these are just some resources. EAPs, depending on how your company is organized, employee assistance programs, or even finding a provider through your insurance. These are some self-assessment tools to not only check maybe where you're at with burnout, as well as your own quality of life within a work setting. And these are just some links I found online. These are not VA endorsed. These are from Google. It's a list of self-care activities just to kind of prompt. Not everything needs to cost money or take a ton of time, or even ongoing activities in Arizona, day trips, things like that, to really get out of town, if that would help as well. So I believe that is the end of our presentation. Don't have as much time for questions as I'd hoped, but if there's anything, we're happy to field some questions.